It's DRYDEN Ross, President and CEO of the Dryden Regional Health Center, here today with an update on the COVID-19 situation in Dryden. Dryden has not had any new reported positive cases over this past week. That means Dryden just had the 4 cases that were positive and have all been considered resolved for quite some time. We do continue to test people on a daily basis at the assessment center. We've done just over 200 tests on Dryden patients in Dryden between the assessment center, the ER, and our partnerships with EMS and the Dryden Native Friendship Center. EMS and the Friendship Center are able to send people to various locations, the First Nation communities and people in their homes, to do testing on those people that can't come to the assessment center, can't make it in. So that's really helpful and really working well. At the hospital this week, we had a focus on continuing with our readiness and mock codes and mock exercises with our staff, audits of processes, that sort of thing. We are continuing to be ready for any patients that may come in. We do have 1 to 3 patients a day in that are pending swabbing results, and during that time we do treat those patients with isolation procedures like we would if they were positive until we know we get confirmation of a negative swab, and then we can take them off those isolations. So we are and will remain doing that. One of the other big focuses of this week, you've probably heard in the press that well over 70% of people who have died in Canada from the COVID-19 virus have been in congregate living situations, long-term care homes, retirement homes. So each retirement home and long-term care home has been partnered with a hospital in their community. So we've been partnered with Princess Court. They've done a really great job since the beginning of this pandemic in ensuring they are ready, and with having visitor restrictions, that sort of thing, keeping their patients very safe, their residents very safe. But they've just formalized it a bit with Ontario Health. So we've been working with them and offering any support we can to ensure that those very vulnerable people in our community are very safe. The other focus of my talk today is it's Doctors' Day, and I want to give some recognition to the physicians in our community who have, especially during this pandemic, been such an asset. We are really blessed in Dryden with our physician staff. We have a very engaged staff, very helpful staff, and physicians, and we are extremely grateful at this time. I mean, they do a great job all the time, but during this pandemic, and I particularly want to talk about the physician leaders we have in Dryden. So Dr. Bruce Cook is our chief of staff, and he's been available to us day and night, attending many more meetings than he would ever like to, offering his advice and counsel and collaboration with us to ensure that the hospital is as ready as we are for this situation. So thank you to him, Dr. Stephen Verioki, Dr. Rian Bester, as well as Dr. Isabella Apresh, are also our physician leaders. They're chiefs of their various departments, and all of them have been so helpful, so available to us to ensure that we are ready, and our policy and procedures are what they need to be. They also, all the physicians have changed their practice, have changed their schedules to ensure that everything is covered off: the ER, their clinics, the inpatients, our alternate site. So we really want to express our gratitude and appreciation of our physician group in Dryden. tonight, it's posted on our Facebook page, but tonight at 9 o'clock, you're asked to turn a light on in honor of the physicians in our community. So I would ask you to do that just to let them know how much we appreciate the work and stress and dedication that they display. So thank you to all the physicians, and thank you to you all for listening to my update today, and we'll talk to you next week. Thank you.